Hey everyone, I am Dr. Anthony Dakpallah, but you can call me Tony. Today we are talking about something that causes a lot of anxiety: breast lumps. You feel a lump, or your doctor finds one, and the first thing that comes to your mind is this a cancer? But here is the truth: most breast masses are not cancerous. Let's talk about the probability, the types, and what happens when one is found. First, let's look at the numbers. Out of all the breast lumps detected, especially in women under 40 years, about 80 to 90% are benign, which means they are not cancerous. And only a small portion turns up to be malignant, which is cancerous. So, statistically speaking, a lump is more likely to be harmless than dangerous. But we can't tell which one is which just by feeling it. And so, we need to do other investigations. And here is where imaging comes in. So, let's talk about benign lumps. There are several benign or non cancerous causes of breast lumps, and these includes fibroadenomas. We can have a cyst, we can have just fibrocystic changes, we can have fat necrosis, we can have an abscess or a hematoma. Let me break these down a little bit so that we can understand it. So, a fibroadenoma is one of the most common types of breast lumps in young women, and it's usually a smooth and freely mobile lump in the breasts. It may feel like a small marble that moves under the skin when you are examining it. Fibroadenomas are not cancerous, and they usually don't turn into cancer. So let's move on to cysts. Cysts are fluid filled sacs or balloons that come and go and often are related to our hormonal changes. We may also have fibrocystic changes where the breast tissue becomes lumpy or tender during your menstrual cycle. And feeling this, you may think that it is a lump, but it's just your breast tissue. And then we may have fat necrosis, where we have firm lumps that form after likely an injury or maybe a surgery. And we also have hematomas, which may also form after an injury or trauma to the breast, where you may have blood accumulating and then coming together to form something like a lump. We may also have an abscess, where we have an infection forming pus within the breast, and it may feel like a lump. So, all these deserve attention. Um, and it's still important that when we feel something for the first time, we have to go to the hospital for them to assess. We'll talk about malignant or cancerous lumps. Cancerous lumps are usually hard, irregular in shape, and fixed to what we call the underlying tissue. That's maybe fixed to the muscle or the skin or something, and they do not move easily like the fibroadenoma does. Sometimes we may also have some skin changes where the skin may turn red, and we may have what we call pod orange, which means the peel of an orange. So it may look like that of the peel of an orange, where we have thickening of the skin and then some pores within them. You may also have nipple retraction. So we need to know how our nipples look like. And so some people have nipples that are not perky in general. You just know how your nipple look like, so that in case you see anything like a retracted nipple where the nipple goes is inverted or goes inward, we can attend the hospital. And we can also have nipple discharge, which could be of varying colors, you know. But again, you cannot tell whether this is malignant or cancerous or benign by just palpating or looking at it. So let's see what happens before we go to imaging. So before we even do an imaging, your doctor will take a brief history and do a physical exam. They will ask things like, when did you first notice the lump? Is it painful or is it rapidly changing in size? They'll ask about your family history, which may include family history of breast cancer. And this helps to guide our next step, and this is usually imaging. Now, imaging comes in after a doctor has put in the request, and we have various types of imaging. We have the ultrasound, which is the first test for younger women, mostly below the age of 40 years, and also for pregnant women. And we also have mammograms, which we may do for older women above the age of 40 years. Or if there are any suspicious features, sometimes we may do an MRI, and we may eventually proceed to do a biopsy if we feel that the lump is suspicious or there is a concern for cancer. Imaging helps us to characterize the mass, and once we are able to characterize this mass, we are able to tell whether it has a high potential for becoming a cancer or a very low potential. And based on this, we may ask for a biopsy, or we may just do a follow-up. A follow-up will be done if we feel that the lump there's no concern for a cancer. So what happens next when this lump is detected, and we feel that it is likely cancer? We would request that you do a biopsy if we are uncertain. And with a biopsy, we will take a small sample tissue from the lump. This is done by us inserting a needle into the lump and taking the sample. And by doing that, we after doing that, we take it to the lab for the pathologist to look under the microscope. And based on what he sees, he will be able to tell us if it is cancerous or not. He'll be able to also tell us what type of cancer it is, if at all it is cancerous. So that's why screening and prompt evaluation is important. So let's wrap this up. Not every breast lump is dangerous, but every lump deserves evaluation. Early imaging and diagnosis saves lives. So, if you found this helpful, give this video a like, share it with someone who might need it, and subscribe for more easy to understand explanations about scans and imaging. I will see you in the next episode.